At Gloucestershire Hospital's NHS Foundation Trust, the Saving Lives programme forms a core part of our approach to healthcare-associated infections. We believe that by working together in a consistent way, making infection control everyone's business, we can significantly reduce healthcare-associated infections and ensure our patients are as safe as possible while in our care. Colleagues on our wards have worked tirelessly to reduce infections and make our hospitals a safer place for our patients to be. Here are just a few examples of our Saving Lives heroes at our hospitals.
My name is Wendy Moran. I am the Manual Handling Advisor for our Trust. And as the Manual Handling Advisor, I go to all areas within our Trust. And one of the areas I was impressed with was cardiology at Gloucester Royal. In particular, the healthcare assistant Wendy Parker. One of our duties is to do a bed exchange, and we ask all staff to clean the beds before the exchange takes place. And I was really impressed with the standards of Wendy Parker and her cleaning of the beds.
My name is Coral Boston. I'm one of the infection control nurses. And today I would like to nominate Holly from 9B, who shows initiative, direction, and recently successfully helped to coordinate the norovirus outbreak on her ward.
My name's Jennifer Farmer. I'm one of the infection control nurses, and I'd like to nominate 7B as it's been 78 days since their last C. diff positive result.
Hello, my name's Steve Moore. I am the TB specialist nurse at Gloucestershire. I would like to nominate Ward 8B because of their commitment to excellence and the delivery of good quality care to my patients in general.
Hello, my name's Teresa Patterson. I'm the lead nurse for the Renal Outpatients Department. I would like to nominate my team who worked really hard in the last 6 months to reduce peritonitis rates significantly.
Hello guys, my name is Dr. Roy Chandraramnan. I'm a senior house officer, currently working on Garrowing Ward 1. I had the pleasure of starting work on Garrowing Ward 1 since August 2015, and I've seen a massive improvement on the ward from an infection control point of view. Simple gestures such as hand washing between every patient that we see. Other introductions such as microbiology ward rounds, where they had microbiologists coming around to take a proactive approach about changing people from intravenous antibiotics to oral antibiotics, by which it reduces a lot of rates with cellulitic infections that patients might get by having cannulas in. So for these different reasons, I'd like to nominate Garrowing Ward 1 and also Sister Shranthi for working hard to bring forward all of these changes. Thank you.
Hello, my name's Philip Lort. I'm the Practice Development Nurse for the Surgical Division. As my infection control hero, I'd like to nominate Kezia Bertman, who is a scrub nurse in orthopaedic theatres and also a member of the theatres education team. In the time that I've worked with Kezia, every time I see her, she has a multitude of plans, ideas, anything that she wants to do to try and improve the lot of the surgical patient and reduce their infection rates. So far, she's worked tirelessly on perioperative warming, on wound dressings. She's got business cases coming out of her ears. Everything she does is there to reduce the risk of developing an infection during the theatre pathway, and that's why I'm nominating her.
Hello, I'm Hilary from Ward 7A, Gastro Ward, and I would like to nominate 7A for all our hard work in improving infection control.
My name's Karen Thomasina, I'm the matron for the neonatal unit at Gloucester Royal. I'd like to nominate Simon Peary and Michelle Grant for all their work on the sepsis bundle for the neonatal unit.
Hi, I'm Kim, I work for therapists. I'd like to nominate the infection control team because they've always been there for me and they're there for everybody out there if you want them. Good for advice, they'll come to the ward, they'll do some training on the spot for you as well. And one thing I want to say about infection control is challenge bad practice, because I do.
I'm Craig Blaithwaite, I'm the ward clerk manager, and I'd like to nominate ward clerk Tarina Holford on Ward 7A. She has an excellent front of house reception personality and deals well with the infection control team.
Hello, my name is Lynn McCune, Senior Nurse, and I'm also a member of our Trust Safeguarding team. I just wanted to share that from a Saving Lives point of view, Ward 2B, whenever I go to Ward 2B, very, very hot on making sure you do the gel, wash your hands in and out. very proactive. Also just want to be a big mention for all our Essence of Care champions and everything that our Essence of Care champions do to promote good standards, and particularly around hand hygiene and clean environment. So thank you to all our champions.
Hi, I'm Sister Annie Ellion. I'm a senior sister on Hazelton Ward and job share with Catherine Butler. I'm here to talk about infection control champions. I'd like to thank the whole team of infection control nurses. They advise us really well on the wards, and they are available, which is a real help when we're not sure what to do. I particularly like to mention Catherine Pitts. I remember she had to teach us all about Ebola and extra personal protective equipment. She had a whole room of very unruly professionals, and she had to give a really, really important message, and she ploughed on, being extremely dignified and showing us all exactly what to do, and gradually she got the room completely under control. She's also very good about praising people and their infection control habits, and also doesn't mind if we ask her the silliest question. And we want to thank her very much.
Infection control means so many different things to different people. So I've been thinking about what does it mean to me. Well, I look at it at two levels, I think. Firstly, the big picture, and then the small picture. So for me, what's the big picture? Well, first impressions. We only get one chance to make a first impression. And for me, that's about our hospitals looking tidy. If it looks tidy, then people assume it's clean. You'll see me walking around the hospital picking up bits of paper from the floor. And people talk about judging the book by its cover, how the outside of our buildings look, how our signs look, cigarette butts around the place. So there's something for me about the big picture, which is about each and every one of us taking responsibility for setting a really positive impression about our hospitals. If it looks clean and tidy, then we know that patients will have more confidence in the services that we deliver, and they're more likely to believe, quite rightly so, to believe that we've got really good performance when it comes to that small picture. So what's the small picture? Well, the small picture starts with our absolute commitment to not harm patients when they're in our care. And sadly, if a patient gets an infection, whether it's perhaps a surgical site infection following an operation, or they get Clostridium difficile, C. diff, you might have heard us talk about, then potentially that patient comes to harm, and they come to harm in our care, which is something that we never ever want to happen. So we're really focused on that. I'm really focused on that. Delighted with the team that we've got that lead infection control. I've spent some time, brief time with Coral and the team, really hearing about what matters to them and how they approach their roles. So from ward to board, this really is a great example of where infection control matters to absolutely everybody, myself included.
We are proud of the improvements we've already achieved, but we know that by working together, we can do more to reduce infection. We can improve hand hygiene in all areas, further reduce post-48-hour C. difficile, further reduce multi-resistant organisms. But to do this, we need your help.